Oh yeah, right there. So as I angle it, it's kind of traveling through those muscles a little bit differently. You can see the twitch. Yep. All in through here. If I angle towards there, you'll see the twitch. Hey, this is Nicole over at Kalkstein Chiropractic. I'm over here with Eddie. We're going to be doing some focus shockwave on his anterior shoulder. So let's get you going, Eddie.
Oh.
All right. Gel's going to be a little chilly. Yeah, not fun. Very chilly. All right, Eddie. Is it kind of where the scars are? Is that, yeah, okay. All right, I got you at 0.1, the lowest. You just let me know how we feel. I'm going to start kind of on like this side.
Gotcha. Hit it right there.
That's the spot? Cool.
What did you do to your shoulder, Eddie? Didn't you hurt it bad?
Yeah, so I tore my labrum during high school football, and the first year I didn't need to get surgery, and then the year after I retore it again, and that's when I needed to get surgery on it. And I think it was about 5 months of rehab. It's perfect right there.
Yeah.
And then you can turn it up a bit.
You got it. Let me crank you. We're
You
gonna
can go into 2 bars right now.
Oh, okay. We'll go 2. Eddie Big Dog, let's go.
I'm not messing around today.
Oh yeah, we're busting it out today.
So even after the surgery, you still have pain?
Yeah, so it's been about 8 years since I've gotten surgery, and yeah, you still feel like the nagging dull ache, and after working out it can be a sharp pain too, but after using Shockwave it's been helping tremendously.
Do you notice oh sorry Carly, do you notice the like your fatigue level decreasing with the shockwave treatments?
It does decrease.
Yeah, that's what I thought. Cool. Just curious, because I know that's what I've heard a lot since doing the shockwave treatment. A lot of people have told me that they the good effects last longer and longer the more they do the shockwave treatments, which is really nice.
Do you have a favorite treatment in the office for your shoulder?
I definitely do. Well, besides this, it would definitely be laser. I've just been giving a lot of treatment to patients on light therapy. I've always been jealous. I haven't gotten it, and I know this is going to be my favorite treatment.
Yeah, I think the combo is really nice too. I think I see a lot of patients have a lot more benefit from the combo as well.
Yeah, right there. That's the good spot.
Yep, I saw that twitch up in here.
Okay.
Ooh, yeah, you can see it still as I angle it.
It's in use right
Oh
now.
yeah, right there.
It's nice and comfortable.
So as I angle it, it's kind of traveling through those muscles a little bit differently. You can see the twitch. Yep. All in through here. If I angle towards there, you'll see the twitch.
Wow.
And then you come back out, and it twitches again. Yep.
I don't think I've ever caught the...
Yeah, so that's a lot of times what I'll use when I'm doing this. You'll see where it's traveling, and that's kind of where I'll try and shockwave, because you know that that's kind of where the sound waves are wanting to go. Reach that tissue. Yep, there it is. You're right, Eddie. Oof. Yeah, that's a tough spot. So I'm going to kind of hit it from the back a little bit, and then I'm going to go deep. It's going to twitch eventually. Yeah, that's the release. Just released all right in there, yeah. Come around here. Oh, there's another release up in here.
Yeah.
Oh yeah.
Had it.
That was good.
Yeah.
All right, Eddie. That was 1,200. How you feel?
I feel great. Great.
Awesome.
Hey everybody, it's Mike from Kalkstein Chiropractic. We've got a patient here today that we're going to be doing some of our focused shockwave on. So we're dealing with two different problems here today. We've got right wrist and left ankle. The right wrist is a result of a somewhat recent car accident, and the left ankle is a pretty constant off and on problem that you've had ever since a pretty significant ankle rolling, ankle sprain, if you will. So we're going to go ahead and get right into it again with our focused shockwave. Our patient here is not new to focused shockwave. This is definitely something that she's gotten a couple times now. Is this third session, I want to say, for the wrist?
Yes.
Okay.
On this round. We did previous shockwave rounds in it before.
Gotcha. How do you think it's reacting so far?
For me, especially right after the car accident, this was a game changer. I think I healed so much faster.
Perfect. Now we're just kind of knocking out the rest of what's in there.
Scar tissue.
Gotcha. Like we've talked about on other videos before, the focused shockwave is really good at not only removing scar tissue, it's really good at breaking down kind of any sort of tendinopathies that you may have. So like we were saying, kind of right after that car accident, that's when you're dealing with just the inflammation in general from said tendinopathy. But of course, after a prolonged period, after surgery, etc., you then have the problem of scar tissue building in the area anytime you cut into the skin and make that incision. So like I said, multi-uses, it's kind of the jack of all trades in that regards. So we love using it here at the office. Let's go ahead and jump in though. So I'm going to start you off pretty low like usual, and just like always, let me know as we get to, you know, that 4 or 5 out of 10, and when we start to find some pretty good spots. So I know a lot of it's going to be kind of
right in there. You got it.
So is this already our 4?
That's pretty good, yeah.
Okay, perfect. Now, not as much on the sides, it's kind of right on the top. So when we're doing the focused shockwave, we're not aiming for the most uncomfortable thing in the world. That's why I was kind of cueing that 4 or 5 out of 10. We do want it to be a little uncomfortable because this machine, the way it works, the energy is very pinpointed. So if you're not feeling that discomfort, if you're not feeling a little bit of pain, it's going to be tough for us to know we're truly on the right spot.
You're on the right spot.
Perfect.
Yeah, right there. Woo.
There we go. And sometimes even just changing the angle, like you guys saw on the video there, will make a pretty significant impact. So any plans coming up for this Thanksgiving?
Hanging out with the family.
Nice. This video will probably come out right around the time Thanksgiving drops. So that's a pretty solid question.
Yeah.
Are you all the families local? No travel at all?
Nope, no travel. Pretty easy peasy.
That's always nice to be able to see everybody and have minimal travel. Right there doing okay? Yeah. So, unlike our other shockwave, the focused shockwave, while uncomfortable if it hits bone, it's not going to send that vibration up and down the entirety of it. It's actually very beneficial for fractured bones as well. So that's why we're kind of able, with such a bony region like the wrist, we're able to use the focused shockwave and it not just be the most uncomfortable thing in the world. Now you can definitely tell from the reactions we're getting, it's not comfortable, but it's not the worst thing in the world.
Nope.
And we're already about to be done right there.
Yep.
We've got, I'd say, about 30 seconds left.
Okay.
I have a question. Hello.
Got a little dirt on my boots.
Hang in there for me. We're almost done. There we go.
All right.
All right, round 1 is all complete.
So we're gonna go ahead and do a brief break while we get our patient here switched around in the bay so we can blast the left ankle. So we will see you guys back in just a second. All right, everybody, welcome back to part 2 of our video, our second round of Shockwave, and today we're discussing the benefits of playing soccer in your flip-flops.
Don't do it.
So that is ultimately what the ankle sprain is from, unfortunately. So we're going to be treating the ankle now. We have a little bit of a different head, like you can tell on the Shockwave. We need it to be a little bit more closer to the surface. We don't need that full depth or penetration that we could have with the other head. It's a little bit more superficial. So this is where we're at. I'm going to go ahead and start to turn it up just a little, okay? So it's kind of right around this region here, would you say? It's still not very strong.
Right there.
Okay. Is this too much?
Down.
Gotcha.
Okay.
So this might be too weak, but I kind of know where the spot is,
Yep,
so I'm going to
that's
turn
it.
you. Is that 4 or 5 though?
Pretty good, yeah.
Perfect. All right, so I'm going to spend a little bit of time here, and then we'll move around. So do you have Thanksgiving week off?
We have a half day on Wednesday, and then Thursday and Friday.
Nice, okay. That's about what we have here at the office. We have Thursday, Friday off.
Nice.
I knew because working with kids, usually they have like the Thanksgiving breaks. That's what
Yeah.
I figured. It's not as much as we get towards the Achilles, right?
Correct.
Okay. But then when we come around to the other side, it's probably somewhere around there.
Yes.
Okay. So when we outwards rotate, I'm going to hit that part too.
Okay.
Right there a little bit? We're kind of going around the entirety of that ankle. You can see it's a little bit swollen still around the bone itself. So that's kind of the guidance here. Not only location of pain, but we can kind of see the swelling as well. So that's how we're able to kind of see where we should really be focusing on. I'd wager there's probably a little bit right in there too. Yeah, because you can see right here. I'm not sure if that's coming up on the video, but there is still a little bit of swelling there as well. Okay, so just a couple more seconds and then we'll change positions and kind of get the other side there. There we go. And let me just wipe you off real fast. There we go. And if you want to go ahead and we'll take this. Yeah. Slide that under. Perfect. So again, that side, and then you were saying up the foot, kind of? Was that what you were
Right
saying?
under the bone, where the swelling is.
Okay, gotcha.
I usually have pretty bony ankles, just not right now.
Just not right now.
Not on that one.
Right. I'm going to start you off right at the pressure that you were at on the other side, but
Okay.
just let me know if that ends up being too much, okay?
Okay.
So let's... Oh yeah, that is pretty substantially swollen. Is that too much already? You want to turn it down?
No, I think it's okay.
Got it. Doing okay as we kind of go up here?
Yeah, I can go down.
Turn the pressure down?
Yeah,
I gotcha.
just one.
No worries.
In that one spot, yep.
Right in there? Okay. Just had your ankle jump on me. I'm trying to find the spot that it was
Right
just
there.
at.
Yeah.
Yep, right there. Not only are we going off of patient feedback, but every so often when we cross a spot that there's a little bit of feedback, you know, you can kind of see certain fibers dancing around, and that's what I'm kind of getting. You can't really probably see too well in the video, but there's just a tiniest little bit of a twitch going on. Up here, not too bad?
No, not too bad.
Turn it down.
No, it's okay.
You okay?
I'm okay.
Are you just saying that because you're being filmed?
No. Okay, maybe down one.
I gotcha.
Just in that one spot.
Yeah. So that was right
Yeah.
there. And we're almost done too. So maybe about 30 seconds left. Okay, so that was our 2 areas of focused shockwave treatment. Once again, we were blasting the wrist. That was a little bit more of a, I don't want to say acute, but not a super chronic problem. It was from a somewhat recent car accident. Now this, the ankle problem, far more chronic. So you kind of saw both windows. We can attack any sort of problem with the shockwave. Well, I don't want to say any problem, but tendinopathies we can do a lot too with the focused shockwave. So if you have any sort of chronic tendinopathy, if you have anything acute like our patient here today does, come on into the office. We don't advise you playing soccer and flip-flops, but if you want to do that too, you can end up on the table as well. So come on down, guys. We're Kalkstein Chiropractic, your local Towson, Baltimore area chiropractors. We'll see you next time.
Hey, welcome back. I'm with Jayla. We're going to show you Shockwave Therapy, right, Jayla?
Yes.
This is what type of shockwave, what type of system do we have here?
We have the focused Shockwave.
Alright, so focused is different than radial.
Yes, it is.
There's different types of input you can use via Shockwave. There's a lot of different companies out there. This is a really awesome brand through Chattanooga. They did a great job of bringing this technology into our office, and they're the force behind the laser therapy as well as the radial shockwave. I was exposed to a form of shockwave at Walter Reed about 8 years ago, and that technology really didn't kind of surface with this type of acoustic and electrical components that we have now till recently. So this is very, very new. There's no offices in the area with focused. Focus has been really helpful for some of the deeper structures, and radial has been very helpful for more superficial things that we deal with, as well as trigger points. So for something that's deep, like a heel pad, I like both modalities, but I'm going to demonstrate focus today, as well as for some calf tension and Achilles tension that I have on this left side. What do I have again?
You have heel fat pad syndrome.
Ah, yeah,
There
heel
you go.
fat pad
You can put your
syndrome.
leg down.
Yep.
Yep.
Common or not common?
It's pretty common. 1 in 10 people get it.
1 in 10 people?
Yes.
All right, so 10% of the population right now.
Yes, yes.
And tell me a little bit more about it.
So, heel fat pad syndrome is like the second most common foot sort of like injury or version of plantar fasciitis. Plantar fasciitis being the first one. And then this is the second one. And it's so common because our heels take a lot. It can absorb almost 1 to 3% of someone's body weight. So your heels are shock absorbents and they take on a lot. So when they're overused and taken on too much, that heel pad fat starts to decrease.
We can all take a page out of Jayla's book, staying on top and studious when it comes to medical conditions that come into the office. Just want to give her a shout out for the effort and the energy she puts towards patient care here.
Yes, researching always.
Always researching,
Yes.
always learning up on things.
Thanks to Dr. Warren, of course.
Listen, it's a team. And a really common thing, and it's a stubborn thing that we see. And the reason people get it is very, it can be diverse. We can get started if you're cool with that.
Okay.
Is that cool?
Yeah.
All right. Because I know I just saw Miss P just walk by. And I know
Gotcha.
she's waiting on focus for her hip, so I do.
Oh, yeah.
I don't want to hold her up. And I think Nick gave me the look like, hey,
You gotta get started. All right.
patient first. So
Okay.
we will do this real quick. I'll say this: the reasons people can get it, like you can have someone that has like a surgical intervention on the opposite side, and then they compensate, and then they kind of build that gait or that pattern over time, and then they start to stress one foot more than the other. That could be a way they do it, and it can be just habit as well. There's definitely some functional components that put people to stress one side more than the other.
I don't want to scare you. That's why I don't want to.
What, do you have this thing ramped up or something?
No. Have you had this before?
Jayla's like, I got my review next week. Let's talk about it right now.
Are you ready?
Yeah. It's my second time getting it.
Okay.
And every time, wow.
See, if he was still giving his spiel, he would have had to stop.
I would have had a wow in the middle of that sentence. That's so crazy. It kind of blows my mind where it hits. It kind of reproduces the sensation when it's really irritated almost to a certain way. Or like at least it pinpoints where that irritation is. I shouldn't say it reproduces it, but pinpoints where it is. It feels good.
Is that
intense right there. Holy smokes.
that too much?
No, we're good.
Okay. I'm gonna hang out in this
Oh,
area.
you're gonna hang out right there?
Yeah.
Alright, Dale, you got it. It's yours. You got the raise, okay? So really commonly we see it, oftentimes doing light therapy and shockwave on it. So I think that if, and we're joking a little bit, right? But if you're someone that's dealing with plantar fascia, heel fat pad syndrome, or Achilles tendinopathy, kind of all these conditions kind of lie in that same field of, just say it for what it is, in lesser words, stiffness of the tissue, overuse, overstress of the tissue. And oftentimes when we take a technology like this, it gets in there and works it, breaks up scar tissue, stimulates cellular activity, stimulates stem cell activity, and then also on top of that we utilize light therapy to use to help with that proliferation of blood flow and the good things that happen when we're healing from something. Increased mitochondrial activity, all those things. We're trying to like work that tissue, we're trying to wake that tissue up, and then we're trying to remodel that tissue through proper movement and stretching. You going up to the calf?
Yeah.
Okay. No warning. I got it. Just going straight for it.
See, I didn't know if you needed that.
Jayla, I need that.
I thought you were a pro.
I have no pro.
All right. That feels okay there?
Yeah, I'm at a 1 out of 10 intensity.
Okay. You can go up a little bit. I'm gonna hit that Achilles now. That might be. Is that okay there?
You are good there, yeah. 2 out of 10.
Okay.
Jayla, what do we look for when we're hitting this?
We are looking for a 6 out of 10, no more than that.
No more. Why are we looking for that?
Because we don't want people to jump off the table, 1. And then 2, you still get therapeutic. It's still therapeutic if you go up to that pain threshold. You don't want it to be anything someone can't handle. All right, we have a little bit left. That was our safety break.
So it's dialed in for their comfort, but we also are getting some work done, huh?
Yes, absolutely.
So if I were to say to you, hey Jayla, I can't handle that, what would you do?
I would turn it down, or I would change the head to the focus shockwave.
Alright, so holy mother.
Turn it down.
No, I didn't say that. I call my mother holy. Saying hi to her.
What's that for you?
I don't know. What's what for me?
What out of 10?
That's okay. Will you hit a spot on that a little higher and then go medial right there? You can hang out there. It's cool. Oh.
See, people say you can hang out there and then they're like kicking and stuff. That makes me nervous.
Well, you just have to get there. Then you're there, and then you just hang out, and then you breathe through it, and it's all right.
You want a little more?
I'm just a verbal guy. Sometimes I like to talk through things. Okay, Jayla?
Okay. You want a little more, Dr. Morris?
Yeah, I'm here for it. This is my first time I've gotten this on my foot and calf. I really want to know what it feels like. I want to experience it on this area. I've had it on my knee, I've done it on my hip, and I've had some people that are on it.
Oh, and just so you don't get confused,
I don't know what I was going to say.
Where do you feel this at? Do you feel it here, or is it moving?
What moving?
Do you feel it like in a different area, like in your toes or anything?
Oh, my soul. So I like using this with light therapy, soft tissue work, adjusting the ankle, brady adjust my ankle, and then I will when I hit the pavement, start running a little bit more. I'll come in. It's going to be a little sore, but this is a really nice way of getting on top of it. I probably haven't had a consistent amount of therapy on it, but if I really am going to be training with this guy here, Team 2020, even though he's trying to beat me in the race, I don't know what that was about. Trying to compete. Who has the better number? I don't even know. Where our team chemistry is right now is not great. We're going to work on it. Okay? But, yeah. So I'm going to get this once a week with Jayla, get adjusted by Brady along the way, and then that's usually how I'm going to manage this from a treatment standpoint. Once a week for 4 to 6 weeks, light therapy, PT along with it, soft tissue work and adjustments, quite a few different things, but it makes it speed up. And it's a really chronic, hard condition to treat, just like plantar fasciitis. So it just needs a little bit more work. It needs repetition. Wow.
Feel that?
I really do. My heel feels really good though right now. Like that first spot you hit. Right on it. Ooh, right there. Do you feel that through the head, Jayla?
I do, kind of sort of the feeling.
It's good. So, that is Shockwave, that's the adjustment, that's the Team 120, that's Jayla, who's just crushing the game of studying about different conditions, who's teaching me now at this point. Since the beginning, really. Jayla, thank you.
You're welcome, you're welcome.
And then for our next video that we're going to be doing, we're going to be representing the sweatshirt on our YouTube channel. Not just the t-shirts, but sweatshirts too. And remember, all the proceeds go to Hunt's Honey. Shout out to them.
Hey everybody, this is Mike from Kalkstein Chiropractic. Today with me I've got Sydney, our newest chiropractic assistant here in the office. So this is our intro video for Sydney. We're going to be doing it a little bit different this video. Sydney will eventually get a adjustment video just like everybody else, but for today's specific video we're back with another radial shockwave video. Sydney is a student here at Towson University, so Sydney's got a little bit of bilateral shoulder down into the scap and trap region, a little bit of pain, a little bit of discomfort, really just that overall student kind of stress of wearing that backpack. You know, they carry way too much books, all that fun stuff. So we're going to go ahead and get into a little bit of Shockwave today. Like you guys know, Shockwave is really good at addressing problem areas, especially if it's pretty localized, like what Sydney's dealing with today. Not very acute, more just kind of daily wear and tear sort of symptoms. So we're going to go ahead and get right into it. Again, we've got our ultrasound gel, we've got the radial shockwave. We're going to be doing both sides of the shoulder, but we'll start with the left side first today. So we're going to keep our red head on. We don't need it to be that super wide wave. We just need a little bit here because we know kind of right where we're dealing with problem-wise. Now, Sydney, as you know, help me find about a 4 or a 5 out of 10 on discomfort, okay? It shouldn't start off too terribly uncomfortable, though. Okay. That feels pretty light so far?
Yeah.
Okay, perfect. I'm going to keep the pressure right here, and I'm going to kind of explore a little bit. Is that a little tender there? Gotcha. Now, is this already that 4 or 5, or? Okay, perfect. If you want me to turn it down at any time, you just let me know, okay, Sydney?
Okay.
So how are you liking the office so far?
I like it, and I feel like I learn something new every day.
Definitely. We're big on the continued education for both doctors and CAs, and you know, like I was saying in the start of the video, Sydney's still a student at Towson University, so you know, we might be trying to influence Sydney just a little bit to go the chiropractic route. You guys know Dr. Warren. He will try to sell everybody on it, so just be prepared for that, Sydney.
He's already started.
There you go. He's already started. So now, as we dip down into the shoulder blade, is it tender at all down in here, or is it more up in this region?
Both.
Both? Okay, perfect. We grab a little bit more gel then.
Oh my god.
Does it feel much different from the focus?
It does.
This is much more localized than the focus. The focus shockwave, it almost skips 2 inches into the skin and then starts putting in all the energy. This is more like a very strong Theragun, so you're feeling that slapping on the skin, and that's even kind of what you're hearing with the treatment as well. You can hear that very percussive pounding back and forth of that instrument. The focus is a much quieter machine because it's actually going through an electromagnetic current versus this being a percussive way to make that current or way to make that sound wave. Little tender there? Yeah. You can see the look on Sydney's face for sure. So I'm just kind of checking with my finger every so often to make sure that I'm not near bone, but this is definitely that sweet spot right where the backpack's pressing against Sydney the most. There we go. One side done. Let's get you wiped up real fast.
How was that?
It was great. I'm gonna sleep like a baby tonight.
We found a couple good spots for sure. Are you having problems with sleeping, or is it more just kind of, you know, after a school day, after wearing the backpack, it bothers you?
More so just after school and work, getting
Okay.
back. Little discomfort, but not really a hard time sleeping.
Gotcha. Okay. Well, good.
Are we
I'm glad
switching
it's.
sides?
Yeah, we're gonna go ahead. So if you wouldn't mind popping the hair over, perfect. Yeah, I wasn't sure if the comment about sleeping good tonight, if you were having trouble sleeping. I'm glad it's not gotten that serious then.
No. I mean, I have to study anyway, stay up late.
Fair.
So,
You have trouble sleeping regardless of this.
yep.
Gotcha. Alright. So we're going to keep the pressure the same, but let me know if this feels too weak or if it's too strong. I'm going to move that hair right there. Perfect. Right in that shoulder blade again, huh?
Yeah.
So I'm just kind of taking my thumb and just following along the line of the scap. So we have bone from about here to here, kind of following that C curve. So we're just staying right outside of the bone. Obviously the spine's in the center, so we're just kind of finding that sweet spot right between the bone. Really just getting all in that scapula's muscle. Right there is that tender spot from the other side as well. Is that a little tender on this side too, or not too bad? A little bit?
Yeah, it's like the same.
Yeah, Sydney's definitely got some inflammation, got some spots in the back and the shoulders for sure. Like we said at the start of the video, it's that very typical kind of student wear and tear just from that heavy backpack sitting on the shoulders. You know, the backpack's straps are very thin to be stylish, but also the thinner they are, the less surface area, so they can really start to dig into the shoulders, depending on what kind of backpack you have. Would you say one side was worse than the other, or not pretty equal?
Yeah.
Gotcha. So the reason why we went radial pulse, or this machine, if anybody's wondering, since we're dipping so far into the scapula and we're really dropping, you gotta think the collarbone, we risk the chance of going into the lung field with our focused shockwave. So that's why, even though lately in a lot of our videos we've been really kind of favoring the focused shockwave, we still have certain contraindications we have to watch for. We don't obviously, with our patients or with our coworkers, want to do any long-term damage. So if we would be doing the focus shockwave and really blasting down here where I'm at right now, we would be in that lung field, we'd be causing permanent damage. So that's the reason for us picking the radial shockwave over the focus shockwave for Sydney for today. Now you might see in some of our other videos we do the focus shockwave, but that's what we're kind of keeping in mind is, are we dropping under that collarbone right there? Alright guys, so once again, radial shockwave. This is Mike from Kalkstein Chiropractic. We've got our new CA, new chiropractic assistant, Sydney here. Come on down into the office, come meet Sydney, come get some treatment. We'll see you soon.
Hi, my name is Tanisha. I'm a chiropractic assistant here at Kalkstein Chiropractic, located in the Baltimore area.
I'm Jayla. I'm also a chiropractic assistant here at Kalkstein Chiropractic.
And we are going to be talking about my knees.
Both of them.
Both of them. When I was 13, I was diagnosed with patellar tendinopathy after going to France to train for a ballet intensive. And it was a lot of walking, a lot of jumping, all of that. So it just put a lot of strain on my knees. And I've had knee pain since.
Okay, patellar tendinopathy goes by many different names. Goes by jumper's knee, runner's knee, and then something called Sinding-Larsen-Johansson disease. All of these basically are the same thing, patellar tendinopathy, and that's going to be the tendon that holds your kneecap against your shin or your tibia bone. So that tendon there is being overused and it is angry, so that is why it's causing Tanisha some pain here.
Unfortunately.
She's just dancing too good.
Yes, obviously, it's just so great.
And we're gonna do some focused shock waving on her knee.
Yay!
All right, you can go ahead and lay down for me.
Right.
Have you had focus on your knee before?
No, I'm actually low-key kind of nervous.
Oh, this is gonna be exciting. Okay, you can lift up your legs. So I'm gonna put this here to kind of relax your legs a little bit. So, and I'll start on this left one right here.
That's the worst one. That's Linda.
Linda.
Linda and Regina.
Linda and Regina.
Yes.
I have the big standoff here. This is her first time. It is on her knee. There's like not much like muscle right here. So we're gonna start with a large standoff. We're gonna use some gel. I'm gonna move the table up a little bit. Don't get motion sickness.
Okay, I'll try.
All right.
It's a little cold.
Sorry.
No, you're fine.
All right.
Do what you gotta do.
Let's make sure the settings are low.
Yeah, please.
Okay, I'm gonna start off. Okay, have you had Focus Shockwave at all?
Yes. Last week I had it on my calves.
Okay.
It was great.
All right, let's do this.
It's not too bad.
Okay.
Oh gosh.
That means I'm gonna turn it up now.
I know. I know. Wow, that's not bad though. It's like not more than a 4.
Okay.
I could tolerate it. Oh my god.
All right. And is the pain usually in the front of your knees?
Yes.
Yeah. That's where it usually hangs out for patellar tendinopathy.
I'm feeling it for sure.
Is it too much?
No, it's not too much. It's just.
We're gonna find out which knee is worse during
I'm
this.
telling you, it's Linda. Oof. I started out with the knee pain only on one leg.
Really?
But then I got into physical therapy and my PT was a dancer. So she would watch me like jump and she realized when one knee was bad, I was landing on the other side first. So then it was compensating and then they would just swap.
Yeah.
You know when this foot starts raising.
Yeah. I'm like trying to. Are you okay? I'm
Yes,
checking again.
it's a lot of dysfunctional tissue right there. That's for certain.
Yes. Let me get up closer to like the actual kneecap.
Ooh, that right there. That's where it hurts the most, but it's not bad. But like that's where it's really prominent.
That's where it's attaching to your kneecap there.
Yeah.
That tendon. Unfortunately, we're supposed to hang out in the worst spot, so I'm trying to.
Oh, okay. Please find a new spot.
Don't worry, I'll be back to that area.
I know. I already know. And my knees are hyperextended, so it doesn't help the knee pain at all.
Oh, nice. We're gonna move down into here.
Holy. Okay.
You're doing amazing, Tanisha, okay?
I'm really trying. Oh my gosh.
Are you at a 4?
Yeah, it was starting to get to a 6 a little bit, but it went back down to a 4.
We're halfway there.
Whew, this is the longest halfway
There you
point.
go. That is your break. How are you feeling?
I'm actually feeling pretty good.
Okay.
It was very intense at first, but it definitely got better as we went on.
All right. We're gonna try Regina over here.
Okay, yeah.
That's her name.
Yeah, that's Regina.
We're gonna move over to her. See how she's feeling.
Okay.
And see if that's actually the worst, the worst one. It's gonna be cold.
Regina's usually calm. It's Linda who has like.
What's the left?
Linda. Yeah, Linda usually keeps it together, but Regina has her moments. Okay, it's Regina today. Oh my God.
Wait, let me not go in that area. I had to turn it down a bit. I was not expecting
Wow,
that.
me either.
Doing okay?
Yeah, I'm literally holding my hands together so I can. put the tension there. Oh my God. Ooh. God.
I'm sorry.
It's okay. No pain, no gain.
Oh gosh. What number are we at?
Right now she's at like a 6.5.
Oh my. You have to be vocal.
Tolerable, very tolerable.
Okay.
That's why I'm not like, ooh, take it off or change the settings. It's fine.
Where do you feel it most?
I feel it right under my kneecap.
That's crazy.
Which is definitely was bothersome. Right there. God! No, go back. It's fine.
Is it though?
Yes, it's okay. I just did not realize I was in this much pain until now.
How much damaged tissue you truly have.
Right. Oh my gosh.
I feel like you're taking deep breaths over there.
Breathing exercises.
Literally, it's the only thing keeping me sane.
All right, I'll get out of that area.
Thank God. Yeah. Okay, that sound is intense. Oh, I lied. Okay. But you know what? I would rather do this than the radial for my knees.
Really?
Yeah.
I mean, yeah. Have you done radial for your knees?
No.
Oh, okay.
And I really don't think I want to
Yeah,
try.
I don't think you could. That's a lot of bone right there.
Right.
What stuff were you doing in PT to help with your?
It was so long ago, but she used to have me ride bikes, do everything that I was doing in class, so the things I was doing at bar, in the center, and a lot of heat and stem.
What like dance move aggravated it the most, do you think?
Definitely petite and grand allegro. So jumps, I was a big jumper, so it put a lot of strain on my knees. I didn't feel it as much when I would turn or be at the bar because I had more support, but in the center, you definitely have to hold your core. So it is a lot, and you have to be light on your feet. I don't know how people do this. Like every week.
No, yeah. Literally
okay,
asking for this.
that is not the spot.
Not the spot.
Yeah, please.
It is the spot. But
it is a spot. Okay, you can go back. It's fine. I just had to brace myself.
And then you can stay there, right?
We're already pretty low.
Yeah. Well, now I don't feel it. So actually, yes, go back.
Okay. Alright.
Wow!
I'm done torturing you, okay?
Thank God.
This has been fun for me.
Yeah.
You?
It actually was kind of fun.
Okay.
It was a little painful, but it was fun. I liked it.
Alright, let's get some of this gel off. Alright, I want to see you do one of those dance moves now.
Oh.
Just kidding.
I was about to say, didn't know this was that type of party. Right.
Walk around a little bit. Tell me how your knees feel.
Ooh, they actually do feel better.
Good.
Like already. Usually I feel a lot of tension like down here, like towards the front, even with me just standing. But I don't feel it as intense now. Even with me lifting my kneecaps up.
You may have some soreness.
Yeah. Definitely going to be sore later, but it'll probably feel a lot better by tomorrow. Yeah. That was great.
Okay, so that was us dealing with Tanisha's patellar tendinopathy. We used Focus Shockwave, and she has new knees.
Yay!
Just kidding.
Linda and Regina is better. She's here.
Yay. Okay, that's all for today.
Hey everybody, this is Mike from Kalkstein Chiropractic. I've got Eddie with me here today, and today we're doing things backwards. I'm going to be the one receiving the treatment. just to give you a background of what I've got going on in my left extensor mass of my forearm, I've been having a little bit of pain. It's a little bit sharp, particularly when I'm doing back exercises. So with the lat pull down, particularly kind of during that moment of loading the elbow is when I'm really feeling it. Just to kind of give you a taste of why we're treating it diagnostically, the extensor mass, as we know or may not know, is responsible for cranking the wrist and fingers into extension. So what happens is during the lat pull down, you can particularly crank a little too much on that elbow, on that extensor mass, that group of muscles. That's essentially what I've done. A little bit too much of overworking the area, not enough TLC. So that's why I've got Eddie with me here today. So we're going to do a two-part video. First part will be with Focus Shockwave, our favorite tool here in the office, and the second part will be a laser session. Like you guys all kind of know, Focus Shockwave, we're starting the inflammatory process. We're going to bring in the laser afterwards because that's going to help us get through the inflammatory process just a little bit faster. All right, without further ado, let's get started.
All right, let's see here.
So I'm going to position myself right there. Yeah, Eddie's already treated this spot for me once with the Shockwave, and just kind of like we preach with all of our videos, you know, you definitely need to stay consistent with any of your treatments, even if it's acute, even if it's, you know, a very, very, very minor problem. It's going to take, you know, you throwing 1 or 2 sessions at it just to get it taken care of. So that's why we're here. I've got a back day later tonight, so going to be doing some more lat pull downs, the exercises that are aggravating it. So I'm going to hope that kind of treating it prior to will help me get through the exercise a little bit easier. I'll have to pay a little bit more attention to that after stretch and, you know, post recovery, but hoping that we should be able to get through the exercise this afternoon or this evening with less pain or no pain at all. So let's go ahead and get started.
Let's do it.
Yeah, right. Go up a little bit and right there. Turn me up just a tad bit though. But that's going to be the... Oh, you're on the bone right now.
Oh.
A little bit. Angle it towards me and up though. Yeah, right there. Yep, there it is. Obviously, you know, a little bit of a trial and error in order for me and Eddie to find the spot, but like I said, this is the second time that we've attacked this particular problem. Just a couple days in separation from one another, so we're pretty keen at this point to right where it is. And you know, again, just knowing the anatomy, where is the muscle group that we're trying to find? Yeah, right there's perfect. Where is the muscle group that we're trying to go after? All just helps the CA with administering this particular modality and just really kind of making sure that we're as efficient as possible with the energy that we're pumping in.
Mike, are you okay with this intensity?
Yeah, that's perfect. I think if I had any more, I'd probably be unable to talk.
Yeah.
I think this is the first time YouTube is seeing your tattoo.
I think so, actually, yeah. Got a little bit of color on there. Shout out Dave Waugh from Stay Humble. So, we're gonna hit this with about 1,500 pulses. So we're a little bit about 2/3 of the way done, a little bit over half. So again, we're going to do a little bit of Shockwave, and we're going to come in on a second video that we'll follow this up with, and we'll do some laser therapy. Again, just ultimately trying to get all of that inflammation, all of the tendons and tissues, the cells that I've kind of messed up from that overworking with the lat pull down. We're just cleaning it all up. A really nice kind of basic way to think about the Shockwave, and this is a really, really crude way to think about such a nice technology, is it's a scrubber brush. You're scrubbing away all of the gunk, all of the things that cause pain, discomfort, inflammation, and you're going to just replace it with new cells. Like I said, a little bit crude of a way to phrase it, but it's definitely pretty accurate in terms of what you're doing.
Thank you. It's just me back here. Yes. Yeah, girl. Keep on front.
Should be just about done here in a second. So we're sending a little bit more energy than usual into this spot, just mainly because we're trying to test out a couple things with our treatments and just kind of seeing how much we should slowly over time increase the treatments themselves. Obviously the first time you get something done, it's going to be a little bit shorter, but then to further increase the treatments, to further increase the effectiveness of it, you do have to slowly increase your treatments over time, be that either volume or duration. So that's what we're kind of tweaking with right now. Some of you guys might notice this is a little bit longer than a usual session, especially for such a small area. But it's going to be a little bit of a measure of patient discomfort as well as how often you've gotten that treatment. Now, I have only had this flare up, if you will, for about 2 or 3 weeks now, but this is a problem that I've had before in the past, probably at this point about 2 years ago, so it's been a little bit of time, but obviously I'm wanting to attack it as aggressive as possible because the last time I did have it was actually around for about 6 months. So anyways, that was our shockwave treatment. Part 1 of part 2 on treating the extensor mass and the elbow there. We're going to go ahead and do a cut. We're going to bring out the laser. So stay tuned for this second video, everybody. But once again, this is Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor. I'm Mike. This is Eddie. We'll see you in the next video.